Hello UK Dreamers, welcome back to the channel. I am Dr. Aman and today I will be talking about my experiences for the NHS interviews. As most of my friends have asked me how to prepare for the interview, what's the pattern and all. So I said, okay, let's start with my journey first, and we can get more people along the road from different specialties about their interview experiences. So I worked in the field of emergency medicine back in India. So yes, I was trying desperately to come to the UK, and I had not completed my membership exams nor had given PLAB. So I asked few of my seniors, is it possible for me to go, and most of them were very discouraging, to be honest. So somehow by surfing internet and attending a conference, and I got insight, okay, there's some scheme that can let you in the UK and then you can start doing stuff here. So with that, first of all, I did my IELTS. Once I did my IELTS, I actively started looking for jobs, but as most of you guys also face that, or most of the jobs would require a GMC, so that's why I always stepped back. I don't have a GMC and all and all. But since I was in the emergency medicine field, I applied to the Royal College of Emergency Medicine MTI scheme. They are very helpful. They sent me a complete set of documents which I was supposed to fill and send them back, which I did, and apparently they got me 2 interviews. Then those interviews were a very basic, simple ones. So today I would discuss about 2 of my interviews. One was a face-to-face interview in Delhi. So it is a very big trust in the north of England. So they came, like I had given my CV applications and everything. So it was a very basic one, just simple questions. Why do you want to come to the UK? What are your plans about the UK? 2 of the clinical scenarios, and when can you start working? So that went very simple. I honestly did not enjoy my interview then. But while searching for these jobs, and the Facebook page of MTI, I got a text from one of the trust that they're looking for international fellows. So I said, okay, let's give it a try. So I sent them my CV and waited for a couple of days. Then I got a message from them that they'll be taking my interview. So yes, the interview was planned, and I was a complete idiot that I did not read the mail properly, which most of us do. So if you are getting any mail from the UK, read those mails with all the depth you can, because we as Southeast Asians do not have the habit of reading the mail through and through. But yes, we'll miss a lot of things, as I did, because my mail had been written like Mr. So-and-so, a very respectable guy, very respectable doctor, the primary reason I'm here today. Okay, back to the basics. So Mr. So-and-so will be taking your interview. So I did not read the entire details of the mail. I said, okay, it's a Mr., it must be some HR guy or something. So I just finished my night shifts, came back, just woke up and sat in front of the computer screen saying, okay, what HR guy is gonna ask me much. And then when the screen opens up, I see a gentleman with a stethoscope in his neck, a consultant tag coming along, and I realized, okay, now I'm in trouble, because this guy does not look like a HR guy. He definitely looks like a doctor. So now he introduces himself as Mr., but he's a doctor. So that made me learn that in the UK, emergency consultants, surgical consultants may opt the title of Mr. instead of a doctor. So if you are looking for a MTI interview with surgical specialties or emergency medicine and you're getting a mail with Mr., it's a consultant, my dear friends. Don't mess up like I did. All right. Okay, so now I'm in front of the computer screen, and this gentleman starts to ask me the basic way the interview proceeds. So like, he asks me about myself. So I introduce myself, tell a little about myself, and then he is like, take me through your CV. So most of the guys, what they do is, though you make a CV, but you never go through your CV. Your CV is what is virtually representing you. So each and every word mentioned in your CV should be known to you. It's not like you've mentioned it but you don't know about it, or anyone else has actually made your CV for you. Don't do that. That ends up getting your marks deducted and maybe getting you rejected. So yes, and then comes the basic question I guess everyone is being asked: why do you want to come to the UK? So yes, everyone may have their own perspective, but I would just tell what I said. I said I wanted to have an experience of the NHS, work toward my membership exams, maybe fellowship exams, and work in a Western healthcare system, learn like the evidence based medicine art, and hence and so forth, like whatsoever. So he said okay, and then an unexpected question came out of nowhere. I studied in Russia, Ukraine. So I'd mentioned that I'm fluent in Hindi, English, Punjabi and Russian. So suddenly this gentleman started speaking me in Russian, and I was totally lost and confused because I hadn't spoken Russian in a while. I graduated in 2011 and this is 2019. Like, how can I be so fluent in Russian? So then what I could say is like absolutely blank. Then so that was one mistake that I did. I just wrote it because I thought, who's gonna ask me anything in Russian? So yes, as I said, every word in your CV counts. Okay, so once this was done, I was taken into a clinical scenario ride with this gentleman. So I was asked basic questions, like the first one was an elderly gentleman with a history of syncope, possible differentials, possible pathophysio, and the basic management line. And then the second scenario was a chest discomfort in a patient. Again, basics about ECG, all the blocks and the MIs, and initial management, and then what happens if the patient crashes. So the basic resuscitation is what they would be definitely asking you. The third scenario was a young chap with abdomen pain and what should be the differentials and all. So the clinical part was still okay, though I was having the most adventurous trip of my life, I would say. But I thoroughly enjoyed the interview. So once this was done, then after the interview, the formal interview, I just had a brief talk with him that how did I do. So this is what most of the people will not ask. So if you're getting interviewed by someone who's working as a specialist in such a advanced healthcare system, they must be noticing some things in you which you think are absolutely fine. So what I would say is always ask for a feedback. Always. You think that you are performing well, but there may be some shortcomings, there may be some mistakes that you're doing subconsciously but you're not realizing. So it can be a good check upon yourself. So always ask for a feedback, as I said. And a few things which are very, very universal that you should follow is be confident, keep smiling, don't carry a very, very simple attitude. You need not be a very, very rude person, because that person who's calling you is also sharing his valuable time with you. So just be a little grateful. Don't think that it's gonna end up in a interview, in a job or not. It's just a learning experience. Honestly, all the interviews I gave for the NHS were a learning experience on their own. And a few technical things that I would lastly like to add are what I did was that I was not in a very, very comfortable lighted room. So whenever you're going for an interview, dress well, get into a proper lighted space with a good internet connection, with a good mic, good camera, because in this virtual world you won't be having face-to-face interviews. And of course, if we are sitting in the countries where we are applying for the MTI, having a good internet connectivity with a proper technical setup will definitely add on to your things, rather you being on a cranky internet and not hearing them, or they can't hear you well. One more thing I would like to add, the difference between an MTI and a non-MTI interview. In the MTI interview, they are not expecting you to stay in the UK. So they would be asking you, how do you see yourself in 2 years? So be very, very frank that I want to learn and give my membership exams and come back to my country. Come back, I don't know if it's a good idea to say that, but MTI is whole soul about you coming to the UK, working and going back to your country. So I don't think there's any harm of you adding it. Yes, if you want to continue further and you think this is the best system for you, there are various other options. But if you're preparing for an MTI interview, just be confident, just read through your CV, make a presentable CV, and things will go good for you. So hopefully you'll prepare well for your interviews, and I wish you all the very best. And as I said, in the coming weeks I'll be collaborating with few other people from various other specialties on how their interview went and special tips that they can give you. Till then, keep watching our channel, keep supporting us, keep subscribing to the channel. Thank you so much. Take care. Cheers.